true and apparent defect. Now in the first image on the left hand side we are having a apparent defect. So apparent defect means the extent of the scar, the entire extent of the scar vertically as well as transversely in relation to the appropriate landmarks. So that marks the apparent defect. And true defect is when we plan either our incision or excision, and when the actual defect is going to be created after we excise the contracture in this particular case, that defect would be the true defect. Now we will begin with the steps of marking the true and apparent defect. Now first step is to position both the patient and the sort of replica of the patient with neck in extension. Now please note here that both the patient and the other candidate which we have taken are of the same stature and build. So we have to take into consideration the bony landmarks. So we mark the symphysis menti, we mark the angle of the mandible on both sides. So this is going to be our true defect in this particular case. What is our apparent defect? Our apparent defect is the scar. Only in its transverse and vertical dimensions. Whatever part of the scar we are planning to tackle with, in this case we are going to tackle with only this part of the scar. This part of the scar we are going to excise it. We are planning for excisional release. So this is apparent, and this is true defect. So the same principle